Hello everyone, welcome to this audio podcast. In this series, aligned to the LabZtorm Impact v.3. This audio podcast is in around works that aligns to sort of nephrology research or nephrology works, and sort of looking at what if any other health educational needs for patients with CKD or chronic kidney disease. This is an audio podcast aligned to another a storm robotics blockade, and an audio podcast aligned to storm robotics production. This is an audio podcast that will focus on sort of the results aspects in around this research that took place between 2017 18 on 2000 to 2020 to 2021. So in line to the results, I'm going to highlight the overview will be in context of following on from analysis from analysis aligned and from general practitioners, allied health professionals, and nephrologists and CKD chronic kidney disease patients, and wherein the analysis is or has a sort of a perspective aligned to different themes or several themes. So to begin with, an overview in context of the results from general practitioners. One of the main sort of themes that were derived from in this research, in this works on this research, was understanding of chronic kidney disease, and perception of kidney healthcare. Sort of direct quotations from general practitioners, but also some context in aligned to the inductive content analysis, sort of aligned to this as well. So there are many people also who would not understand, despite leaflets and what the hell CKD is, and what is good for them. Why the health professionals, other health professionals who have expertise and where patients can visit or contact would be more proactive, and relating to chronic kidney disease 2 or CKD 2, GPs code it according to what has been conveyed by healthcare scientists in the laboratory, but because it does not have any physical impact on patient, it does not get described as a problem in patient notes, and not much else. So that was as a direct sort of quotation from one of the participants from the general practitioner side. In content aligned to the inductive content analysis or ICA, there are significant number of patients who do not want to understand what CKD is, and what lifestyle changes are required. There are many people who are also would not understand, despite leaflets, despite leaflets and what is good for them. The GP, the general practitioner or GP here, suggests as others that it might be advantageous or benefit to CKD patients, that they have access to health professionals with specialist sort of knowledge to help understand different disease stages, and at what point treatment needs to be escalated. So in line to the theme, in around a theme surround on education in healthcare surrounding long-term conditions, or LTCs. The overview in this line to this is it's how bothered patients are and how much information do patients want. Having pre-printed information, I mean there's certain things. Information leaflets from different societies or organizations would be helpful to have similar to it would be helpful to have similar for CKD patients. And that's that was a sort of direct quotation from one general practitioner. And the NHS or National Health Service does not make collaboration easy. Community education from MDT or multidisciplinary teams, not just a CKD but other long-term conditions as well. And that's a sort of direct quotation from another general practitioner as well. So in line to the ICA around this, one GP perceives that the level of patient sort of interaction is key in terms of how much information they want. It could be suggested that that the level of patient sort of interaction relates to many complexes, broader factors connected with individual circumstance, demographic factors, health literacy, family, and history. A second GP informs a need for patients to be provided with information and need for education as well. So in line to a theme around education through technology and digital healthcare, a quotation in around this. General concerns surrounding education. Certainly, many hundreds of websites for patients and professionals to choose from via Google, and where the general practitioner also highlights that it can be overwhelming. So in line to the ICA around this, patient care necessitates understanding health, education, seeking behavior, and modes of delivery to improve knowledge surrounding health and disease. Understanding here reveals that large amounts of health information is available to CKD patients online. However, there is a requirement for patients to have guidance on how to navigate context appropriately for it to be sort of applicable and or implemented. So in line to a theme around where the general practitioners were encouraged to highlight some context and around future roles of allied health professionals as well. So CKD2, chronic kidney disease stage 2, and the whole pathway currently still lacking most of the time. Could be a decent sort of channel for those who visit GP land to see healthcare professionals. Healthcare scientists could be involved here, as one general practitioner informs. Smarter algorithms and sharing information, multidisciplinary team approach or MDT approach. Everyone has a responsibility to contribute best practice. GPs focus on acute kidney injury, AKI, and not so much CKD or chronic kidney disease. Renal consultants coming out and teaching general practitioners about CKD has probably been the most significant development in the last decade, as another general practitioner informs. So in line to the ICA context, the ICA sort of context around this, one GP, one general practitioner, one general practitioner suggests a need for a shared approach in care of CKD patients or recipients, where specialists to educate non-specialist health professionals, general practitioners on CKD. So in context, one of the GP informs and states smarter algorithms and sharing information, MDT and again MDT approach. Everyone has a responsibility to contribute best practice. So in line to another theme has been, for example, screening and renal biomarkers. So the perception is unsubstantiated in primary care, and the difficulty that comes is what in terms of monitoring them does patients' blood need a sort of recheck? Are there other underlying causes? And as one general practitioner informs, and no routine monitoring, but there are alerts on general practitioner systems to prompt screening GPs, and so GPs can look at your renal urine protein to provide some sort of indication regarding and relating stage and severity, and not so much CKD, not so much for CKD, more for acute kidney injury or AKI, as a third general practitioner informs under this particular theme. So in line to the ICA context, understanding sort of reveals that there is little consistency with regards to the monitoring of CKD patients in primary care, and the GPs sort of suggest the need for clearer guidance on monitoring CKD patients, especially in relating to severity. In line to a theme surrounding safety and governance. So direct quotation here is, if general practitioners know that there is a patient who has got CKD, or is at risk of developing a CKD, or on medicine which increases the risk of developing renal insufficiency, they will play safe, and it really is about patient safety. And aligned to the ICA around this, GPs, this particular GP's in GP context surrounds understanding where GP relates understanding around patient safety and medication management, and there is a need to be aware of patients who may be at risk of developing CKD due to medication use. Diagnoses and coding are key as part of the as aligned to the ICA context as well. So now that was some context in around sort of the themes in around and from general practitioner perspectives. The next overview, in the next part of this overview, I'll highlight there'll be some context being highlighted in around healthcare scientists and context of allied health professionals. So one of the themes was education through technology and digital healthcare. So health literacy is not always the problem. However, we're seeing more younger patients, and there is a desire for information and wanting to make sense of why things are being done and what they mean. signpost for example, where one healthcare sort of scientist informs signpost to, for example, to a sort of a website known as, or what's been referred to as, patient.co.uk, or NHS Choices. Digital access to a range of health professionals could work quite well, especially if only to provide additional education. A second healthcare scientist informs, and short video clips drilling down basic point of care testing, or POCT, and educational information for CKD patients. For CKD patients and the public would be helpful, as another healthcare scientist informs. And so, in line to the ICA in around this, as well as highlighting a need for easily accessible information on managing CKD available online. One of the healthcare scientists interviewed felt that patients also required or needed digital access to a range of healthcare professionals. Another healthcare scientist felt that visual online education should be available for patients through point of care testing. So, in line to another theme in around future roles of allied health professionals, or AHPs. So, if a CKD patient was in an accident emergency setting, and they were shown in GP land, in that regard, it would be useful or helpful if an A&E clinician could get laboratory context directly from a summary care record, or SCR. Then absolutely it would be helpful or useful for patients and professionals to have a smarter understanding from AHPs relating lab investigations and parameters. And aligned to ICA from another healthcare scientist is healthcare requires smaller links between health sectors, and this could expand roles of traditional healthcare scientists. So in line to this, in line to that information and that quotation as well. Understanding informs the need for health professionals or allied health professionals and hospital clinicians to work more closely together in interpreting laboratory tests surrounding chronic kidney disease, and bringing healthcare provision closer together in supporting CKD patients. AHPs suggest there is a need or requirement for improved digital access to test results for health professionals providing care for CKD patients. So that's some context aligned to healthcare scientists. The manuscript around this works had the manuscript and the sort of the sort of topic guides and the sort of interviews that took place had several themes, but in context of the actual manuscript that went in for peer review, only had a few sort of themes outlined per cohort, owing to the sort of journal remit that the work went in for, that the work was put forward for. So in line with in context of the sort of allied health professionals in contact and the allied health professionals and healthcare scientists. The overview is in regarding two specific themes there. So now, in line to nephrologists and clinicians, or NCs, a theme: understanding of CKD and perception of kidney healthcare. So I suppose one thing about knowing about numbers and understanding them is that if we're over reliant on the numbers, then we might be falsely reassured. For instance, I do not know whether that's an enormous gap. I think part of the understanding of blood results is that it's part of a bigger thing, which is taking control of your illness and understanding its treatment, and being a partner in your own care. So I think it's important. It's an important part that it's an important part of that. But I don't know whether understanding adequately is a big gap to be honest. So in line to some of the sort of ICA around this particular context, this particular understanding and context, nephrologist perception informs, for example, there should be a link between patients' level of understanding and taking ownership of health and self-managing care. So that's one particular that's in around the theme: understanding of CKD and perception of kidney healthcare. Now, in line to a theme: education through technology and digital healthcare. I could look on the internet in various ways, and they can use patient support as they often do. They can do all the sorts of online exploring. Those people who use online those people who use online forums. The here patients have access. Patients have access to sort of fellow renal patients, so they can the clinician in this context is inferring, or at least has inferred, that that patients communicating with other patients can be useful, can be helpful, and also I think and this clinician also says, a clinician also informs, I think that's got a role in finding things out. And aligned to sort of the ICA context in around this, understanding highlights the importance of peer support for CKD patients in terms of providing education and patient support. And aligned to sort of health literacy and professionalism. So now I suppose some people might argue that the information is given in such a raw form as to be complicated to understand for many patients, or that you might say that many patients might not have the ability to understand that information. So in aligned to that sort of ICA context, understanding informs, understanding of aligned to this informs that importance of acknowledging patient health literacy levels and the need to provide education that is accessible to all. So that's some context in line to health literacy, the health literacy and professionalism theme aspect. Aligned to sort of the theme in around future roles of allied health professionals, or AHPs. I mean we got a lot of phone calls from general practitioners or GPs, and sometimes we feel they don't all necessarily need to come through to us, but we're usually available. The registrars are usually available at the end of the phone, and that's where they go. And sometimes you think, yes, they could potentially have other access, and that would be able to answer. I think that would be good, actually. That would be brilliant. So that would be so that's a sort of a direct quotation from another clinician, one of the clinicians, and aligned to the ICA context in around this. So nephrologists understanding inform a requirement for CKD patients to have specialist input or insight in helping them interpret and understand sort of the medical context. And research has several areas. Research forms of several other areas where future roles of AHPs or health professionals should develop sort of best practices. So now in around sort of the themes aligned to sort of chronic kidney disease patients or CKD patients as well. So understanding of CKD and perception of kidney healthcare. So people do not know, and they're mistaken for other conditions. Fluid overload can be a problem. It is because of the heart, again, because the heart needs to work. I've seen it where one of these patients has had highlighted. I've seen it for myself. A lot of people don't understand why and mentioning renal failure is not a good idea, because the patient might not be aware what they are looking for, and some patients will feel there is a certain way they feel, and they will take it as the norm, as one CKD patient informs. So I like to in around the ICA context. So patient informs what CKD is, and also why, for example, fluid retention can occur. The patient talks. The patient who provided context in here, in line to this theme around understanding of CKD and perception of kidney healthcare. A patient talks about how health professionals should communicate with patients around CKD, and how patients may not understand certain medical terms. Context highlights the importance and presence of condition. So in line to a theme, appropriate educational support. So they haven't necessarily got the time to be one-on-one with your care, and where this particular patient is referred to clinicians. So it's a lot more just like, here's what you need to know. Here's what you need to know. So go and look it up yourself, kind of thing. If there was a level of they'd give us if there was a level of they'd give us booklets. They talk about my mum and dad, and explain to them what they could do to help. All that jazz is what this this patient who was interviewed as part of this research, and where it was a patient who had gone through the sort of the transition from pediatric clinics in context of nephrology nephrology clinics, and going into the adult into adult and into adult nephrology, where they and where the young patient informs in around his where clinicians at the time the clinician at the time was it also involved that patient's sort of parents and their mother and father in aspects of the care, in aspects of the patient's care as well. So in line to a theme, a perception of healthcare professionals, I don't think I should go to my GP for checkups. Checkups. That's the reason I've got a consultant. But in my case, my GP or general practitioner is excellent. And again, it's another person I can just book an appointment with and say, actually, I'm a bit unsure about this, or I'm struggling a little bit with mental well-being, or I've got a little concern about my transplant, and she'll talk to me about it. It just so happens that I've had the same general practitioner since 1995, and so she's got the knowledge. It is my big fear about moving away from, so I won't say where, but a big moving away from, so where this patient refers to one part of the city, part of a city, to another part of the city, and what I'm going to do about my GP, but there you go. And especially as I've got where this patient, in line to this theme again, in around perception of healthcare professionals, especially as I've got other issues as well. So I think my general practitioner or GP plays an important role. In line to the ICA around this. So it is important to understand multi-morbidities, and where GPs or general practitioners should work together with patients and allied health professionals. Literature informs sort of patient perception and need for specialist knowledge to manage CKD differs across regions. So in line to a theme around digital digital technology, I think the patients should receive the information they want in whichever way they're comfortable to receive it. So for some of the older patients, they may not be as comfortable with modern technology. They might prefer a phone call or a face-to-face appointment, or a letter. For other people, they may who are a bit more up to date with technology, they might like to go on to have a look at their results on the website and say, oh, I can see that I'm not happy with this result. I better make a phone call. So I think that the patient's comfort and reassurance must be paramount, as one of these patients who were interviewed, CKD patients who were interviewed, informs. So in line to some of the ICA context in around this. So patient highlights a need to receive health education in a range of ways, where appropriate, via face-to-face and verbal communication, via digital platforms online, or by phone or leaflet. Patient also highlights the importance of being able to receive test results online via a website, for example, and such as Patient View. And it is important that patients are reassured about kidney care. So in line to the theme around education through technology and digital healthcare, I think Patient View Patient View has made a massive improvement and a bit of an odd one. I think social media. So now I hold those two I hold those two on an equal level. Something that's more accessible to patients in terms of technology. Patient View is more supportive because it gives you an immediate window into your health, how your renal function is doing, how your blood pressure, how your various levels of blood are, and what could it improve. It is there, but again, it's going back to this thing of learning how to use it. So you can go into a particular blood result, for example, go into your iron result of your blood, and then you can click on that link, and it tell you these are the norms that you'd be between as one CKD participant highlights. So in line to the ICA in this context is Patient View. Patient View has improved self management of CKD, and social media has its place. Technology is integrated into everyday lives. Access to social media also offers patients access to peer support. However, it must not be presumed that all long-term condition patients can interact with aspects of technology, online spaces, or healthcare. Primary care networks or PCNs also offer a solution wherein multiple health professionals or allied health professionals could be involved to support health educational needs. E-learning modules can offer a solution for educational support, and this could lead to sort of higher levels of literacy, health literacy and educational attainment, as the ICA in aligns to the ICA aligns to, again, educational through technology and digital healthcare. Now in line to this and in regarding theme around healthcare communication. I just asked the nurse in dialysis, but to be quite honest, I think the nurse would be reluctant. That's my experience. When you get results, they seem a bit they don't want to be running around. Then the problem is when I was in the other unit, I had a good nurse. Because what she would do is, oh, your results are good, and that's it. She'd just tell me the results are good. If you have reassurances from health professionals and you always have access to them, or you're in doubt, that education would prepare somebody, because you're better prepared when you have more information, as another CKD participant informs. And aligned to sort of the ICA around this, so understanding here reveals the importance of a patient being educated before and following contact with health professionals. Access to health education can prepare a patient, encouraging shared decision making. So now in line to in line to the sort of final theme, if you like, in around the CKD participants or CKDPs. Influences on willingness to take ownership of health. So I think that patient view has made a massive improvement, and a bit of an odd one. Again, I think social media. So again, where the same patient, the same patient and participant informs. Now I hold these onto these two on equal level. I could not pick a favorite, so I'll tell you why. In terms of patient view, I can access my blood test, and I do every time. I do every time I have it. I have a follow up or a checkup. As this CKD participant forms in this interview, a couple of days after my checkup, I go through my blood test, and I'll make sure I'm happy with everything. So in aligned to the ICA. In around this theme, influences on willingness to take ownership of health. It is key to have links between patient accessing test results digitally following medical appointments. Patient view, for example, is secondary care specific. The patient did not indicate, for example, whether access to health records should be between primary or secondary care or healthcare sector specific. By encouraging education across health disciplines, this would reduce inequity, increase influence on taking ownership, and improve overall healthcare in the CKD population. So that draws this audio podcast to a close. The next audio podcast will look into will highlight some aspects in around the discussion and conclusion, and also some sort of overview or summary points in around this works. And so this is an audio podcast aligned to, once again, the LabZtorm Impact v.3. This has been in around nephrology research and what if any other health educational needs for patients with chronic kidney disease, CKD. It's been an audio podcast aligned to a storm logistics blockade, and also aligned to another storm logistics production. Thank you for tuning in.